So next speaker is Dr. Vikas Mittal, a good friend of mine from Ambala, and he's again a very dynamic surgeon, does lots of new things and innovations. He will, I think you run a course on DMEK as well, no? So he will teach us how to do wet lab. He has something very interesting which I found very innovative. So I think I'll let him show you.
Thanks so much, Rishi, for making me a part of this this course. And in fact, I had forgotten that I have already consented that. Then when you made a group, WhatsApp group, then I realized that I'll have to make this trip. So so far, whatever DMEK you have heard of or whatever you see, what are your basic thoughts? It's a fab surgery. At least this thought is clear. ये क्या हो गया?
This is also very fab.
This is fab, yeah. हाँ क्या करना? अच्छा, okay. Slide show करना है?
Okay.
ये तो है.
Any other questions while we wait? Yours is ready. Vikas, shall we go back to him, or are you ready?
Got it.
Okay.
So I was there. So it's a fab surgery that we all know. And anything else? What do you feel about the people who do this DMEK surgery? They are fab surgeons. So do you feel? So what next? So do you want to refer them? So fantastic. So one thing is clear. So obviously everybody will appreciate if you send them the DMEK cases. But next 10 minutes or so will be for people like what she said, that I want to acquire this skill set. And this is nothing but a skill set. How many of you are very proficient in FACO and SICS, or either of them? FACO, SICS. You pass the eligibility criteria. So you can definitely acquire this skill set. I didn't say DSEK, right? So DSEK can be a prerequisite to do your DMEK. Why? Because in case you have a problem, you can at least do a DSEK and patient will still feel okay. But to acquire a skill set, you don't need DSEK. It's a different surgery altogether. So all you need to do is have basic ophthalmology training. That's it. So let's see which category you belong to. You want to acquire this skill set. This is sure. You belong to one of these categories. I have never done DMEK. I want to start it. I've started but stopped it because I'm struggling with DMEK, and I'm scared of DMEK. Oh my God, it will get tear, and then I'll see the edematous cornea next day. Then patient is after my life. I'll see, oh no, let's remove it. Oh, DSEK was so good. I have never done a cornea transplant. For this, please ensure that you need a license and ensure that you have a good cornea training. You are an eye bank in charge, and you are thinking of, how about providing a DMEK roles to the surgeons outside. So if you belong to one of these categories, the next presentation is for you only. Why DMEK? I have put up a few photographs just to boast that yes, I can do DMEK. So I'll skip it. We know that this is an ideal transplant, right? Because the many times, I remember one patient who went to a general ophthalmologist after surgery, and he said, doctor has not done anything in your eye. He has taken money from you, but he has not done anything. And he came back running and he started fighting with me. You didn't do anything. He said that there's no koi putli nahi hai. There's no transplant. So skill set can be acquired, no doubt about that. What I did is, I started doing it in 2013. And this was BOA, Mumbai only. I was sitting with Dr. Fogla. I sat for an hour and tried to understand what it is. At that time, I think 1 or 2 surgeons were doing. They went back, did a few wet lab, and tried to do myself and started it. In first year, I did 10 cases, and out of 10, 6 failed. 6 failed, and my confidence was shattered. I thought this is a stupid surgery. DSEK is such a fabulous surgery, and I'm sure that patient will get 6/9, 6/12 easily. Why do I need to shift to DMEK at all? I thought no, DMEK is a bakwas surgery. Then in one of those ESCRS courses, there was this course in DMEK. It was jam packed. I was standing on my toes like that. I stayed there for half an hour. There I saw stamping for the first time. Stamping, I saw, wow. you know, this is what the problem was. I was thinking it is like a flower petal, it will open like this and all those theory that I had, but actually you can see whether it is in the correct orientation or not. And after I came back, I still remember from Delhi, I called my OT assistant and told him that post two DMEKs next day. And after that, there was no look back. And nowadays, when we do DMEK, we know that it will be, you know, almost perfect as what I think about DSEC. So just out of this graph, just see, I've highlighted two things: started and restarted. Doing is more important. So you'll have to ensure that you do it. Even if you have stopped, again, redo it, restart it. You will definitely get a hang of it. So DMEK, how do you acquire a DMEK skill set? Just pay attention to the next video. It's a very important video, most important video, and I'm going to show you 3 human beings. Have a look what they are doing, and you know, this will be the crux of all the things. You can't panic. Stay calm. Look at the hair. Look at the hair. Look at the hair. Stay calm. This is the DM will always be underwater. Have another look at this human being. Count how many times he got up again, and got up again, and got up again. So ultimately, there are bound to be learning curves. It's okay, right? And the skill set is different. Rules are different. It's underwater rules. These are not the rules which you apply on DSEC. So don't think that you are a DSEC surgeon and apply with that, you know, frame of mind to your DMEK. So what we are going to do in this presentation, we are going to provide you a toolkit where you can develop these reflexes and overcome these learning curves in your own setup. So all you have to do is peel off a DM without tear, then place it in the patient's eye in correct orientation and minimum cell loss. That's it. That's the only thing that you have to do. So there are many simulation model for, you know, pilots. Even the flying is not easy, but there are simulation models. There are simulation models for phacoemulsification. So here again, I am going to show you a few simulation models for each step. So what we are going to divide it, we'll split this whole surgery into various steps. For each step, what are the simulation model, how you can set up a wet lab on your own. So there are 2 parts. One, you have to deal the DM outside the anterior chamber, and one, you have to deal with this DM once it has gone inside the anterior chamber. So let's see the first part. How do you separate DM from donor cornea? How do you learn this? So those people who have never done it, you can, you know, who have never touched the DM at all, you don't know how it feels like, you can go in your kitchen, get a hang of, get a onion leaf. And the inner membrane of onion leaf behaves exactly like DM, and you can you know, practice all these steps which Ashish has nicely shown you. All the steps can be practiced here. Initial partial trephination, we do only partial trephination, so that you separate only DM or maybe another 50 or 60 microns of stroma. And then you can, you know, ensure that you lift the peripheral ledge, and after the peripheral ledge is lifted, you peel only 70%. This behaves exactly like your routine descent membrane. You can create a punch in this, make a hole, and then place the DM back, flip it, remove this button, and you have this hole, this well in which you can practice your stamping. You can see, you can keep some fluid and then stamp it and see what happens. It smudges. So you'll get a feel of it. You'll get a very good feel of stamp, and you can practice, you know, P, F, L, S, whatever, and see what fits, you know, what suits best for you. And then, you know, once this stamping is practiced, then you have to peel off the complete membrane, the second peeling. And as you can see, this roll looks like a, you know, young roll. When you strip 20 years old, 25 years old tissue, something looks like that. Then you can aspirate it in the injector of your choice, and then you can practice even injection of this DM roll into the silicone eyes. These are the normal eyes that we use for phaco trainings. So you can practice all those steps in the simple simulation model. Once you've got a hang of it, now you know how DM feels like, you can practice on the human donor cornea. Tell your eye bank people to give you some rejected tissues, and again practice all those steps one and one again. Once you have practiced close to 10 human eyes, then you are good enough to go. By that time you'll get a, tears. Intentionally you can create a tear and then see how it feels like, what we were discussing. If you have a central tear, see what best you'll have to do. So whatever you are going to do in the patient, do it in the wet lab. So next come is DM injector. So orientation of all the DM injector you can prepare on your own. We prepare it from our rejected patient interface tubes of femtosecond. You can use any silicone tubes. So you just warm it on one side, then take any injector. So, Bosch and Lomb, Technis, whatever, you have to cut it and then just shove this injector into the one part of the tube. Just, clean it a bit. So this, my OT assistant makes this injector and makes it very well. And on the other side, you can put your syringe. In case you don't want a larger one, you can make a smaller one also. So here again, you can try various things and see what fits best in your hands. And then the orientation, how it is. So once the DM is inside the injector, you can take a magnified glass injector. You can, any in your city, somebody can make it for you. And this plastic roll, you can see when it gets rolled, the endothelium is on the outer side and the stroma is inside. When you inject, the bevel is always up. And when you aspirate it, and when you inject, the bevel is down, and you can see the V side is facing up. And when it opens, the endothelium is down and stromal side is up. So while doing these things, you can develop your macro reflexes. You'll get an orientation, how this DM is going to behave inside the injector. So once you know how to peel off, you've got a hang of what the orientation is once the DM is in the injector. Then comes the most challenging part, when the DM is inside. So whatever problems generally happen, it happens when the DM is inside and you have not got, either you could not get the correct orientation, or you have ultimately did a lot of manipulation and led to some endothelial cell loss. So here again, you can use a simulation model of DMEK aquarium where you can develop your gross reflexes. And then I'll show you how to make a wet lab model so that you can develop your micro reflexes as well. So this is any plastic, balloon kind of thing. This is easily available from any chemical, anyone who deals with the pharmacy. And then you can make a plastic sheet, so roll it and close it. So this will become a DMEK aquarium. This will be like your anterior chamber where you can see how the various things that you are going to do inside the AC, those can be practiced. So there are a few concepts: wave, ripple, pin, flow. All those things you can practice once this is inside. So wave are major waves. You are using 2 cannula, and you are pressing just at the edge of the graft. And by these you are creating a major waves in the AC, and through those waves this graft is shifting on one side. So you can do it with your fingers and see how it is, and it is almost the same that we see in the patient. Ripples are mainly, this is used to center the graft. You make some tap on the limbus so that there are minuscule waves that gets created, and through those waves this whole graft shifts, and you can do whatever centration, whatever way you want to do. Here again, doing this will give you a confidence that what exactly is going on inside. Pin and unfolding, here again, you press it one part which is already unfolded, and on the other side you again tap it, make some minuscule ripples and create it through those fluid waves. This will open up. So this again you can practice in this balloon kind of thing before actually doing it. And then the flow, we know that the DM goes with the flow. So in case you have a reverse orientation, you can see this B. So you have to inject the fluid between the iris and the graft, so it gets flipped off. You can see that again you can practice for your macro reflexes, how in case it is upside down, how you are going to make it better. Once you have done, you have got a hang of it, then you can develop your own wet lab model. This again is a very simple thing. You can use this latex material from the gloves. This will make a diaphragm. Over it you place your rejected tissue, then lock it, and your wet lab model is ready. You can practice your pin, wave, all kind of gymnastics. You can make it a chapati roll, triple roll, double roll, whatever, and see how it is. You can make it upside down, then try to lift it. In case you want to decompress it, you can increase the pressure from the outside so that it will make the AC shallow. So here again you can develop this wet lab model in your own practice and practice it. So once you have done enough practice, you have what I feel is at least 10 to 15 cases of DM separation, and at least 10 to 15 cases of you have done in a wet lab model, then only you take it. And if you have done enough practice, believe me, your first case will look something like that on first post-operative day. You can't even make out whether it's a phaco post-op or DMEK post-op. And this photograph was, this is a first PODO of one of our trainees who had come to our DMEK workshop, and recently he had sent me, he did his first DMEK, and you can see the first DMEK also can look something like that. So I don't think you need any 0 year for that. So just read it very carefully. Probability of your starting DMEK is inversely proportional to the number of courses you attend. So if you are attending too many courses, believe me, you are not going to do it. So if you have attended one course, it's okay, it's enough. Please start, do it in your own, and then improvise. You can attend some course to see if there is one point that you are facing a problem at. But if you are attending too many courses, then I doubt. So please go ahead, dare to master DMEK. This is the workshop that we did. Thank you so much. I have these videos that we have used in this, and I'll be happy to share these videos with anyone who you like. Thank you so much, everyone.
Lovely videos, Vikas. I'm glad you're part of this course, because I think everybody wants to learn, has to do wet lab, and you've given some really easy ways which everybody can